Great. Today we have two wonderful ladies who will be presenting to us today and giving us insight into postpartum depression in Indonesia. And with the first person I have with me, Dr. Fika Lilik Indrawati, who is a nurse, midwife, lecturer, and researcher, passionate about improving women's health across the lifespan. Her work focuses on HIV care, psychosocial well-being, and digital health innovation, with strong commitment to empowering women in low-resource settings. With expertise in midwifery and women's reproductive health, she integrates evidence-based approaches into practice and research. She is also experienced in the prenatal yoga and hypnobirthing, promoting holistic, culturally sensitive care to support maternal well-being and positive birth experiences. She actively collaborates with communities and NGOs, translating research into meaningful interventions that enhance quality of life. She has presented her work at international conferences, and she continues to contribute to global nursing and midwifery research. Dr. Fika, we are great to have you. Our second presenter is my friend, who is Kinanthi Lebdawicaksaputri. You can call her by Kina. She's also an Indonesian nurse who has a passion for maternity nursing care. She had her bachelor's in nursing professional degree from University Pelita Harapan in Indonesia in 2012. She also studied at the Labtrobe University in 2010 at the Division of Nursing and Midwifery. She finished her master's degree in International Master of Nurse Midwife at the National Tapai University of Nursing and Health Sciences in Taiwan. Her passion is about empowering mothers in their journey as women, becoming mothers, and thriving as mothers. Currently, she is a faculty member of the Universitas Pelita Harapan in Indonesia and is involved in Adolescent Health Center at the same university. She's involved in teaching maternity nursing, and her research revolves around caring for postpartum women, postpartum depression, and attachment between mother and baby. Our two wonderful presenters, you have the floor, and we are happy to hear from your insights. Thank you, and over.
Thank you, Ophelia, for this wonderful introduction. Hello, everyone. I would love to mention Happy International Day of Midwife to each one of us. And thank you for coming to this session. My name is Kinan, as Ophelia has mentioned, and I am with Dr. Fika as my research team. Let's begin. Slide, please. Let me begin with the introduction of my study. As we all know, postpartum depression is a significant mental health issue that affects not only mothers, but also their infants and family. It can negatively impact maternal well-being, mother-infant bonding, and even child development outcomes. In Indonesia, according to Putri et al. In 2023, from the study of the National Health Research Data in Indonesia, the prevalence of postpartum depression varies widely, ranging from 2.3% to as high as 22%, and this variation reflects differences in populations, measurement tools, and healthcare access. Despite its importance, screening for postpartum depression is still limited in many healthcare settings in Indonesia. In addition, support systems for mothers during the postpartum period are often inadequate. Therefore, understanding both the prevalence and the lived experience of postpartum mother is essential to improve maternal care. Slide, please. However, there are still several gaps in existing literature. First, there is still limited evidence using a mixed method approach that combines quantitative and qualitative data to provide a more comprehensive understanding of postpartum depression. Second, we observe that The emotional experiences of mother during the postpartum period remain underexplored, particularly in the context of Indonesia. And finally, when we search the literature, there is still a need for more contextual data that reflects the cultural and healthcare realities in Indonesia. And these gaps are the highlights why conducting this study is very important. Next slide, please. Based on the gaps that I mentioned before, this study has three main objectives. The first one is to identify the prevalence of postpartum depression amongst Indonesian mothers. The second one is to explore the emotional experiences of mothers during the postpartum period. And the third one is to provide insights that can inform and improve maternal care practices. By combining these objectives, we hope that we can generate a more comprehensive understanding of postpartum mental health. And to achieve these objectives, we use a mixed method approach. And for the quantitative component, we use the Edinburgh Postnatal Depression Scale, specifically the one that already being translated to Indonesia by Sari et al. In 2021. And we measure this for the postpartum depression. For the qualitative component, we collected a reflective statements from the mother to better understand their emotional experiences as well as their personal perspective during postpartum period. And this combination allows us to not only measure the prevalence of depression, but also to capture the depths and the complexity of maternal experiences. Next slide, please. So in our study, we included a total of 54 postpartum mothers, and they were recruited from multiple hospitals across Indonesia, both the public and private healthcare facility. And all participants were within their 6 weeks postpartum, which is a critical period to identify the early sign of postpartum depression. And we hope that this sample help us to capture diverse experiences among the mothers. Next slide, please. So from our participant, we found out that most of the mother, around 80%, they were at age 19 to 32 years old, that indicating that they are relatively young. And then in the terms of parity, most of the mother, they are multiparous with 52%, and 48% is being primiparous. And then for the mode of delivery, more than half of the participants, for 57%, had undergone the C-section, while then the rest delivered vaginally. And this characteristic really provide important in context of interpreting our findings in this research. Next slide, please. So now we study the postpartum depression using the EPDS to the 54 mothers, and we found out that 35% of the mothers probably have depression, and 26% have mild depression, and 39% present no sign of depression. Next slide, please. And also, we see that in the age of 19 to 32 years old, we see here that the mother, they are tend to have probable high depression. So around here, I cannot. So around here, you can see that the mother have a probable high depression for age 19 to 32. And then for age 33 to 45, it's on the possible mild depression. Next slide, please. And for the qualitative analysis, we did then thematic analysis. So we asked the mother to answer 2 questions. The first question is, how do you feel during the 6 weeks after giving birth? And then we asked them to share anything that they want us to know during their postpartum period. Next slide, please. From here, we analyze the theme. So we come up with the 5 themes in this qualitative research. The first one is the mother's emotion during postpartum, and the mother's support during postpartum, and then the mother's mental health condition during postpartum, and then breastfeeding during postpartum, and then also role adjustment. And here we can see that from the statement that given by the mother, we figured out that the mother have positive and negative emotion. Some of the mother mentioned that they have available support, and some of them also have unavailable support. And some of them also mentioned about their history of perinatal mental health, but then some of the mothers said that they don't have the perinatal mental health and history, and then some of them are mentioning that they enjoy breastfeeding, but meanwhile the rest said that they have problem with breastfeeding, as well as mothers that really juggle to have the adjustment in the children because it's the first child, and some of the mother also juggle because this is not their first child, so they have another children that they need to tend. Next slide, please. Now we look at the emotional experience of the mother. So 57.4% of the mother mentioned that they are having positive emotion. This is one of the statement given by the mother. She said, I'm happy, but having mood swings in between. And then 42.6% of the mother also mentioned negative emotions, such as a new mom, I have many confusions on first day, but now I'm okay, and I can see the difference before and after being a mom. Next slide, please. So we then now talk about the theme that we found out in our qualitative analysis. So the first theme is about support. So in here, we see that the mother, they have variety in support received from the parent, from the partner and family. So some of the mother, the participant mentioned that they have the support available from the partner, family, friends, and even healthcare professionals. One of the participant mentioned that they are happy and it is really necessary for them as a new mother. But then some of the mother also mentioned that they don't have support available for them because, for example, this participant mentioned that the husband is overseas, so he never helps directly with the baby during the postpartum period. Next slide, please. Now, the second theme that we discover is about mental health. So the theme of anxiety, postpartum blues, and depression showed up in the statement given by the participants. And some mother, they mentioned that they do have history of baby blues that happens in their postpartum period. And also, a participant mentioned that actually she was diagnosed with anxiety disorder before, but then it get worsened in the second pregnancy, and now it still often recur and affect the thoughts and energy. But also, there are mothers who experience that they don't have history of prenatal mental health, and they are very happy and grateful for the postpartum period and having a little cute baby. Next slide, please. Now, the third theme that we discover is about breastfeeding. So the mother expressed that they were concerned about feeding and the milk supply. One participant mentioned that she really enjoyed breastfeeding because for me, it makes the baby and the mother very close. But we also figured out that there are mothers who really struggle with breastfeeding because it mentioned here in the statement that she feels sad and worried because she can't give the baby a lot of breast milk, and the breast milk still come out a little, and I need to give him formula to help. So this is the third theme. Next slide, please. And then the last thing that we discover in our study is about the role adjustment. So motherhood has been a challenging adapting for the mother. And from our participant, we understand that they experience adjustment as a new mother because this is their first child. It's being stated here as being a new mom, like me, means learning a lot and accepting advice and criticism. And of course, you need to be calm and relaxed to keep your breast milk flowing. But then we also receive a statement from the mother who are really having challenging situation in adjustment for multiple children. So she mentioned I have difficulty caring for a baby on my own because I have two other children who need my attention and it's easier to have a babysitter. So I'm going to offer the floor to Dr. Fika to continue on with our presentation.
Okay, thank you, Kinan, for giving me the screen. So now we're moving on to the discussion. Our findings indicate a relatively high prevalence of postpartum depression among Indonesian mothers, with more than half of participants experiencing either mild or probable depressive symptoms. This highlights an urgent need for early detection and systematic screening in postpartum care. And consistent with previous literature, particularly from Gupta in 2024, our result reinforce the importance of implementing routine screening tools such as the EPDS in clinical settings. And in addition, our study emphasized the critical role of social support. Mother who reported having strong support system, whether from partners, family members, and healthcare professionals, tended to have more positive emotional experiences. This aligned with the findings in Negri and Lee in 2022, who demonstrated that perceived social support significantly influences postpartum mental health outcomes. Furthermore, our qualitative findings reveal that postpartum experiences are multidimensional. Mothers navigate a complex interplay of emotional changes, mental health conditions, breastfeeding challenges, and role adjustment. These factors do not operate independently but are deeply interconnected, shaping the overall well-being of the mother. Therefore, postpartum care should not only focus on physical recovery, but also incorporate psychological and social dimensions in a more holistic manner. On the next slide, please. In relation to the theme of the virtual International Day of the Midwife, our findings strongly reflect existing global challenges. First, there is a clear equity gap in mental health screening. Not all mothers have equal access to early detection and support services, particularly in resource-limited settings. For the second, limited access to emotional and social support remains a significant issue. Many mothers still experience isolation during the postpartum period, which increase their vulnerability to depression. And finally, from a human rights perspective, maternal mental health should be recognized as an essential component of quality maternal care. Every mother has the right to receive not only physical care, but also emotional and psychological support. Thus, our study highlights the importance of strengthening midwife roles in addressing this gap. For the next slide, please. And based on our findings, several important implications can be drawn. First, routine screening for postpartum depression should be integrated to standard maternal care services. This can help identify at-risk mother early and provide timely interventions. And for the second, the involvement of family members and partners is crucial. Strengthening family support system can significantly improve maternal mental health outcomes. Third, midwifery care should adopt a holistic approach. This means addressing not only physical health, but also emotional well-being, social support, and the mother's adjustment to her new role. By implementing these strategies, we can move toward more comprehensive and woman-centered postpartum care. The next slide, please. In conclusion, our study found a high prevalence of postpartum depression among Indonesian mothers, indicating a critical need to increase awareness, improve screening practices, and strengthen postpartum care system. The findings also highlight the importance of integrated care involving multidisciplinary collaboration among healthcare professionals, including midwives, nurses, and mental health specialists. Ultimately, improving maternal mental health is essential not only for the well-being of mother, but also for the healthy development of their infants and families. We hope that this study can contribute to improving maternal care practice, particularly in Indonesia and similar contexts. And before we close this presentation, I would like to hand over the next part for my co-presenter, Kinanthi, who will continue with the acknowledgement and closing remarks. Kinanthi, the screen is yours. Thank you.
Uh, Thank you, Dr. Fika. So, from the bottom of both of our hearts, we would to express our acknowledgement to the VIDM committee for allowing us to present in this event. And also, we would like to thank you all the participants of this research, as well as the hospital and the healthcare professionals. And thank you very much, Dr. Fika, for your guidance and support so that we were able to present this research in this. So now, Ophelia, I'm handing over to you. If there are any questions, we are very welcome to answer them. Thank you.
Thank you so much for the presentation. We are grateful to the presenters. We will ask if anybody have a question, you can put it in the chat room. There is one question that was sent to me privately, so I'll read it out if you can help. So the question is, when and how was the screening done? You mentioned you used the Edinburgh scale. How was it done? The person wants to know.
Thank you, Ophelia. So we actually administer the questionnaires online to the mother. So we gave the mother online questionnaires, and they fill in the EPDS in the online questionnaires, and then we calculated them. And we also asked them to write a reflective statement from their time of their postpartum period. That's how we do the measurement of the EPDS. Thank you.
I can see a question in the chat box from Rixa. Does anybody, Ophelia, do you want to go ahead and read it out?
Yes, I already read and I will try to answer. Thank you for Dr. Rizka for your question about the prevalence, right? And that is an important point for me. For us, the relatively high prevalence were more than half of participants. And so depressive symptoms and might indeed be influenced by several factors. First, the EPDS is a screening tool, not a diagnostic instrument. So we think it might capture early or mild symptoms. And for the second, our sample included mother within the first 6 weeks postpartum, which is a particularly vulnerable period. And therefore, rather than overestimation, we interpret this as an indicating of the need for early screening and intervention. I think.
Great, thank you. Please keep your comments coming. Just a second, I want to check if there are more comments. Okay, thank you for the feedback. We have some feedback too on our sample size. Thank you. All right, if there are no questions,